You're very welcome here today at this edition of the Advocacy Exchange. I'm Brad Love. I'm one of the GRIT co-founders and a health outcomes researcher. And I'm really delighted to be spending some time with you today thinking about the well-being and mental health impacts of negotiating chronic illness. So we also thank you for being here and sharing your experience and your voice and participating in this with us as we build community and empower each other to be more effective advocates in the world. I see lots of people still clicking through, but as we're doing that and we express our gratitude for the chance to spend time with you today, I would like to also point out that we do have ASL interpreters with us today. Emily Cook is currently the person doing that wonderful, important job for us. And if ASL interpretation is something that would serve you today, I'll remind that you can click in the upper right corner of your screen where it says view and change to gallery view, and then drag Emily's box, in this case, to a place that will help you be able to see that. And welcome from Sweden to our most recent comment. As we're settling into today's topic about mental health and chronic illness, I'd love to ask you to share in the chat what you do to maintain balance while you're feeling overwhelmed or stressed. What does it look like to you when you're having a day that is creating some challenges and you're seeking to reorient? Whether it's related to chronic illness or not, sometimes it's just a dog gets into the trash. Sometimes it's a lot of yelling from someone. I had a day personally Monday as I was having one of my big scan days where I was sitting in the bay waiting for a range of tests, and that sent me sideways, if I'm honest. And so as one possible answer, I had to practice a lot of reframing. And I turned my thoughts to be thinking about the idea that this was a useful thing I was doing, as much as I didn't want to be there. This was serving future me. And that was how I tried to cognitively reframe. I see lots of people talking about wonderfully some deep breathing, some walks outside, some meditation, prayer. Wonderful sharing. Thank you. Yeah, meditation, breath work, no doubt about it. Yoga, thank you. Prayer, Olympia, absolutely. Walking by the beach, if only we all had that option. I'm very envious, but I will look at photos as a way to reframe at times. Thank you for sharing all of that. Okay. To get into today's agenda, which will feature some opening remarks from Dr. Renata Kisa, and then a panel of some wonderful colleagues who are walking with us in this mission of advocacy, I'd like to start out by turning things over to Dr. Kisa, who's a worldwide lead for dermatology, immunology, and fibrosis for Bristol Myers Squibb, where Dr. Kisa is going to share some insights about World Psoriasis Day and chronic illness. Before I do that very quickly, I would like to offer one short reminder that Grit Health's Global Virtual Cancer Conference is coming up, November 2nd to 5th. It is a free virtual event for anyone who needs support on their cancer journey, whether as a patient, a caregiver, survivor, advocate, everyone's welcome here. And the theme we seek to work on with that event is that you're not alone in that journey, much like we work on here with the Advocacy Exchange. And also, even if you can't make the live sessions, you can register anyway, which will give you access to the recordings afterward. Because many of these things, like the remarks our speakers are going to make today, are things we'd be wise to revisit because of the wonderful human insights that our colleagues are sharing. That said, I'd love to turn things over to Dr. Kisa and express appreciation for you spending time with us today and sharing your wisdom.
So I would like to just say welcome to the Bristol Myers Squibb Advocacy Exchange. I'm Renata Kisa. I'm the Executive Director of Worldwide Medical, focusing on dermatology. As many of you know, this platform was developed early in the COVID-19 pandemic to provide space and opportunity for patient communities to learn and to collaborate. And today, I'm really excited to kick off this fantastic event which focuses on managing the psychological aspects of a chronic disease. As always, everything we do at Bristol Myers Squibb is centered around patients. We consider patients as the experts in their own experience with their disease. We are committed to elevating patient care to new standards and to deliver what really matters most, the promise of living a better life. And with that in mind, today's event will feature a panel of individuals that represent patients with autoimmune diseases and will showcase their expertise in managing mental health while living with a chronic illness. Additionally, while this panel has representation from various autoimmune diseases, we want to give a special recognition to the psoriasis community with the upcoming World Psoriasis Day on October 29th. And the theme of this year's World Psoriasis Day is mental health. And we'll draw attention to the importance of mental health and mental well-being for people living with psoriasis, which is also a chronic disease. Bristol Myers Squibb stands with the psoriasis and broader autoimmune disease community every day. And we are committed to finding treatments and new and innovative ways to support the autoimmune disease community. I'm honored to welcome you all here today, and I look forward to hearing more about their experience and insights. I also would like to thank each of you for the great work you do on behalf of all individuals living with chronic disease, and of course, for your ongoing partnership with Bristol Myers Squibb.
And as I put in the chat, I really would love to particularly amplify and express the greatest appreciation for your sentiment that people are experts in their own conditions. And thank you for the work that you do every day to help improve quality of life and really consider the lived experiences of people in the autoimmune community. To switch over to our panel, guided by those insightful comments, I'd like to first introduce our moderator, Dr. Catherine Benedict, who's a psychologist and clinical associate professor in psychiatry and behavioral sciences at Stanford Healthcare. Welcome, Dr. Benedict. It's great to be here with you.
Brad, I'm honored to be here. Before I jump in, I thought I'd give a little bit of a background on me, who I am and what I do and how it relates to what we're talking about today. So yes, I'm a psychologist. I work primarily with cancer patients and survivors, which is how I came to be best friends with Grit. Most of my patients are in that post-treatment survivorship period. Many are years past treatment, and there are still a lot of difficulties that come up. And in many ways, it's a chronic condition. Many are dealing with the ongoing physical challenges, and that's hard. And equally as difficult as the mental and emotional challenges, figuring out who am I after this diagnosis? How do I think about myself, my body, and my future? Dealing with uncertainty and lack of control, issues about identity and relationships, whether that's dating, sexuality, or friends and family, and trying to get them to understand what it's like for you. There's a new normal, and it can be incredibly difficult to figure out how to cope with those challenges and find peace and joy and a sense of self again that feels okay and good. This can be an isolating experience. I work with patients around that and finding community. And I think that cuts across a lot of disease groups. And I think we'll hear about that today. And so I'm very honored to be here and to hear about others' experiences and to bring this group together. So with that, I'd like our panelists to introduce themselves. Nitika, do you want to go first?
Thank you so much. Hi, everybody. I'm Nitika Chopra. I am the founder of Chronicon, and I have had psoriasis for 31 years now and a bunch of other things as well. And I'm just really excited to be here and talk to all of you about, the patient experience and my experience with it.
Great. Thank you. We're so thrilled to have you. And Molly.
I'm Molly Murray, and I am the president and CEO of the Autoimmune Association. Really excited to be here today, so thank you for the invitation. For those of you who aren't familiar with us, I'll just give you a little bit of a background. We were founded 30 years ago by a woman named Virginia Ladd, who herself was a multiple autoimmune disease patient. And she noticed that she wasn't alone. Oftentimes, if you have one autoimmune disease, you have many or more than one. And she noticed a hereditary connection in families where multiple members of a family will have an autoimmune disease, but it's not necessarily the same one. So this really led her to question whether there's a common link between autoimmune disease, and she enlisted the help of autoimmune researchers to explore this question. So fast forward 30 years, we are now the leading nonprofit serving as an umbrella organization for all autoimmune diseases, and we're focused on supporting the autoimmune community through our 4 pillars, which is advocacy, awareness, education, and research. So at the heart of it, we operate as a convening organization. It's designed to empower the autoimmune community with the resources and tools they need throughout their journey, and really excited to be here today in this discussion, because we know mental health is top of mind for those living with chronic illness, certainly autoimmune disease.
Thank you. Okay, so let's jump right in. I'd like to throw it to the panel. The first question, just getting an understanding of what it's really like. What are the lived experiences of dealing with a chronic illness? Thinking about physical, mental, emotional, relationship challenges. What is it really like? Nitika, do you want to start?
Sure. Yeah. I mean, I have been living with psoriasis since I was 10. And I would say, depending on where you are in terms of, the age you are when you get diagnosed, it brings up all different kinds of things, obviously. But I would say the biggest thing about living with a chronic illness is it has been a great teacher for me in so many ways. And it's been really a window for me to slow down and really understand like what is going on with my body, and then what are the emotions that are connected to that. I'm not a psychiatrist or psychologist, but I feel like, I'm the best expert when it comes to what's going on with myself, for sure. And I definitely have the map of, what I'm experiencing every single day. And so living with a chronic illness is constant. It's, every single moment there's something that we could be analyzing and looking at. But it's also been a great opportunity for me to have more empathy for myself, for others. It's made me a lot more disciplined and organized. It's made me a lot more diligent with my life and a lot more mindful, because I really have to be aware and in tune with what's going on in every moment with my body. So there's so many ways I could answer that question, but that's sort of what comes to mind.
Yeah, absolutely. And so it sounds like you've really come to find the positives there. Was that a journey for you?
Oh yeah.
To come to? What was that journey like? And sort of holding both the difficult parts and the positive parts,
Yeah, I appreciate you asking that, because I never want it to seem like, oh, it's so great and like I have it all figured out. Like, no. I really find that it's a moment to moment exploration. And so because I got diagnosed so young, I would say the first decade of my diagnosis was an over-identification with being sick. Really, I was really steeped in, I was going through puberty at the time. I had psoriasis from the tip of my foot to the tip of my head for like 17 years. So it was very visible, right? And now it's like having an invisible version of it, and having a visible version of it before was also just a dynamic that I had to work through. Yeah. So there was a lot of challenges with self-esteem, a lot of challenges with lack of confidence, and really not understanding who I was outside of what people were seeing about me. And even, dealing with autoimmune, there were so many things, this was, years ago. So there were so many things I didn't know about the condition, like the fatigue or the challenges with certain foods or different things that I understand really well now, that just constantly had me questioning myself, had me frustrated, had me feeling separate from others. So it's been a really long journey with therapy, with having great resources, with, finding a network that really supports me. But again, it's like a moment to moment thing. And it's something that, as much as we talk about, working on our health and like the disease and maybe the symptoms of the disease, there's all of these other things that we need to really work on to support ourselves through our conditions every single day. So yeah, it's been a journey, and it still is, right?
Yeah,
it still is. Yeah,
absolutely. And that relationship to the body is so central to how you think about yourself, identity. And then of course that plays out in every other aspect of life, right? It's powerful. Molly, Same question.
And I'd love to give some perspective, kind of what we've heard from our patients when you're dealing with their chronic illness. And certainly, one of the things is that it has a holistic impact on their well-being. And, Dr. Benedict, you touched on this, and Nitika as well, because this doesn't just, in fact, it's not just a disease, it impacts themselves. It impacts caregivers, family members, relationships. If you can't get out of the bed in the morning, it impacts your ability to hold down a job. So we know that these, impacts can ebb and flow throughout a lifetime, and they can be different for everybody on their journey. When it comes to autoimmune disease, a lot of people don't realize that there's estimated to be more than 100 autoimmune diseases, and these diseases are varying in symptoms and severity. So they're complex, they're difficult to diagnose, and it can be challenging to find the right treatment. We say as an organization that it's around 4 years for a diagnosis. It could be much longer if you're dealing with a rare disease. But part of the reason that takes so long is because patients often report a vagueness of symptoms. Nitika talked about fatigue. I'll talk a little bit more of that in our discussion today. They just don't feel good. My joints hurt. I have stomach issues. This could be a lot of different things. And so as you're painting that picture to a healthcare provider, it could be really hard to decipher what it is. And you can end up being treated for the symptoms for many years without a proper diagnosis. So, and it usually takes in two parts. The first part is simply getting to the right practitioner, which general practitioners are fantastic, but you might need to get to a specialist like a dermatologist or a rheumatologist. And of course, second part of this, once you got the diagnosis, putting a plan in place to manage the disease and what that looks like over the course of a lifetime. So that, these are certainly challenges. We, as an organization, are actually in the midst of conducting patient roundtables with multiple communities within the subsets of the autoimmune community. And there's a lot of common themes that ran through this that I wanted to share with everyone today. One of the first and foremost, which came up, which is so relevant to our conversation, is the mental health issues that were noted across the board as a primary need. When you have chronic illness, they just kind of discuss their ongoing struggle to find support, a community that understands the everyday challenges, and what living with an autoimmune disease can entail. So really connecting with peer groups who understood their struggle was important. They talked about isolation and depression and loneliness. And Dr. Benedict, as you said, getting back to quote unquote normal, like what is normal? They felt burdened by the stress that they put on their families, whether that's driving them to a doctor appointment or picking up the kids and other life activities. So, and feeling like they have to explain, hey, I'm not lazy, I'm tired, I simply can't do it. So another thing I thought that was interesting is that it described how retelling the story over and over throughout the course of a lifetime of what they've gone through in healthcare settings was triggering for them because it kind of brings up that experience. But also to Nitika's point, sort of the strength and resolve came through with the patients we spoke to. It's a daunting experience, but they described it as a learning process. They reported feelings of self-empowerment as they became adept at self-advocacy, because that really translated into identifying treatments and lifestyles that work for them.
Yeah, it's so great to hear, again, both sides, the challenges are there and they're very real and significant. And at the same time, things to learn and things to grow and feel empowered. When you were talking earlier about how hard it can be to just get a diagnosis, the themes that are coming up for me and when I work with my patients is just the uncertainty, handling that uncertainty. Even when you get a diagnosis, then what is this going to mean for me in my future, right? And then feeling out of control, and again, there's the out of control of what is my body doing and how do I manage this? But then there's that lack of control. Once I get a treatment plan, it's outside, I have to follow it in issues of control around there. So a lot of things to think about. So obviously, there's a lot of themes that cut across, but everybody's journey is different. What are some of the insights that people might not know, kind of digging a little bit deeper that people might not realize about, the unique experienes that patients face? Molly.
Yeah, I think, sure, I'd happy to discuss that, sort of the unique challenges that maybe they're greater population isn't familiar with. And I can describe this in terms of a story and some data that we have. But, Nitika hit on this too, sort of the differences between having a visible and invisible chronic illness, which, at the end of the day, it's all difficult to deal with. So when it comes to visible diseases, I think about a story literally we've had in the last minute with a psoriasis patient. It was a conversation with a woman who was in her late 40s. And she told us that prior to getting her disease under control, she went out to eat at a salad bar. And she overheard one of the other patrons tell the server that if she went to take off anything on the bar, that she wanted the whole thing removed because she could spread the disease. And the patient felt so overwhelmed and embarrassed by that experience that she didn't go back out to a restaurant until her symptoms were under control. And she thought, oh my gosh, I am in my late 50s and I wasn't expecting to feel bullied at my age. So it might sound cliche, but words really do matter. And I think it goes to show that one comment can be really crushing when you're dealing with a chronic illness, on top of everything else that comes along with it. So that's a person who has a visible disease, right? And then there's challenges when a person has invisible symptoms as well, because they might look healthy, but indeed they're not. So again, fatigue, chronic fatigue comes to mind. Earlier this year, we conducted a patient survey on fatigue, and out of the 1,500 respondents that took the survey, nearly 1,000 individuals took the time to write a comment. They didn't have to, but they did, and they said a couple of things. Many things about what came to mind when they were dealing with fatigue. And there was two. I'm just pulled out a couple of quotes for us. One, I don't like being this way. This isn't my fault. I'm not faking this. I'm not stupid. I'm definitely, in all caps, exclamation point, not lazy. I want to be normal again. I hate being like this. And then another quote, fatigue is not something that I use as an excuse or as an example of being lazy. Rather, it's something that has become a part of my life that interferes not only with what I do, but who I am and how I see myself as a person. And so I think these stories, these quotes really exemplify what living like a chronic condition can entail, and that maybe the general public doesn't think about every day. As an organization, we're really committed to understanding the patient journey, particularly in the health equity space, so that we can provide health resources and tools to empower patients along the way that maybe don't exist right now. So kind of getting at that community. So there's often unique considerations when in a minoritized community with certain socioeconomic, racial, gender, geographic considerations. So with that in mind, we're hosting a series of roundtable discussions with communities of color, the LGBTQ+ community, non-binary communities, rural communities, and men. And so there's a lot of things that have come out of this that I could share, but I'll share a few things. With the women of color, they express cultural barriers in communicating specific symptoms that either they just don't discuss certain things with family or caregivers that might be seen as taboo in their communities. For some women, but not all, they were, they said sometimes they don't hear heard in clinical settings unless the caregiver or the health provider looks like them. And I mentioned men as a minority group. It's believed that 88% of those with an autoimmune disease are women, which puts men in a minority among the patient population that we work with. And they express some of the same challenges about being heard in a clinical setting by providers. And they reported delays in diagnosis because autoimmune disease, number one, we know it's really difficult to diagnose, but generally because it's seen as a woman's disease, which is what one young male reported. And he said his lupus was overlooked because the provider said, I really don't think that's what you have. It's a woman's disease. And so he eventually was referred to a specialist and got the diagnosis he needed, but it was delayed. And then he also said, interestingly enough, the psychological impact that had, as a young man to hear that he had a women's disease when, it really can impact men as well. So very interesting. A couple more things. One of the things too that was common between men and women is they both brought up fertility concerns. And we typically hear that with women a lot, but when we got into conversations with men, they're worried about that too. So I say all of this because these are some of the challenges that exist out there, some of the things that maybe the broader population doesn't think about, and that we're even as an organization getting more dialed into.
Yeah, thank you for that. And it's not even what I'm hearing is it's not even the broader population, but even doctors, right? And
Yeah, right.
doctors are not.
Correct.
I'm glad you brought up issues of health equity and the differing experiences of minoritized groups. And so I definitely want to circle back to that. But Nitika, do you want to add your thoughts? Thinking about, what are the real lived experiences and what don't people understand?
Molly brought up some really, really great points that are incredibly important. I think the conversation around, as a woman of color, navigating the healthcare system and also navigating just my own family system and figuring out how do I advocate for myself within conversations with my family who might be, not as comfortable speaking up or using their voice or, really honoring their feelings in a way that they weren't always supported to do. That has been probably one of the biggest things in my journey of, my health with a family, and especially like the women in my family who are sort of told like, okay, you need to be quiet and kind of sit in the box and do their own thing. I'm out here, first generation Indian woman, New Yorker, and I'm just like, no, we don't do that. We don't stay quiet. We speak our mind and we say what's really going on. And that has come up against so many things throughout my entire health journey. And then taking that to the doctor's office and saying like, okay, yeah, I know that you're technically a person of authority and I need to be looking at this, in a certain way, but I'm walking in there like, no, I'm the patient. I deserve to be heard and I deserve to have my voice be heard. And what I have to say is valid and I'm smart and I'm educated. And as I said before, I know my body better than anyone, even if I don't know a specific diagnosis or the medical term for something. Having that confidence has been a really huge thing. But it has been a journey, as I keep mentioning. It is not something that I rolled out of bed at 10 years old having confidence about. It took years. And even, as at 41 now, I find that even still, I am constantly trying to evaluate, is this doctor really hearing me? Am I really feeling supported when I'm going to this person? Am I getting the treatment that I need? It's up to me to constantly be asking those questions. And sometimes it's hard to admit, no, you're not getting the treatment that you need. And so then you have to do the labor, which is unfortunate as the patient, to go back and say, okay, I need to fight harder to get what my needs are and get them met and all of that. But yeah, there's so much that I could say about that part of the journey, but that's a little bit about what I wanted to share.
We're definitely going to touch in on the advocacy piece because that's so important, right? And it can be a very hard thing to do. There's even cultural, influences there of how that relationship with the doctor should be, but coming back to your relationship with your family and friends, and maybe even in dating or relationship contexts, how did you come to have confidence in there, and what was that journey like? What were the reactions you heard from loved ones, and how'd you navigate that?
Yeah. I mean, with psoriasis in particular, because it was, so visible for so long. I was actually just talking to a friend about this the other night. Sometimes I'm like, I feel like I have amnesia around how hard it was. I have no idea sometimes how I dealt with it, to be honest with you, because it was so aggressive and so loud in so many ways. But yeah, I had to, I mean, in terms of like dating and stuff like that, there just comes a point where you just have to say, I don't have a choice about what is going to be happening in this situation. Like, this is what I've got to work with. And you're either going to like it or you're not. And it's the same thing with friends too. Like being somebody who maybe has specific needs, like I have psoriatic arthritis too. So no, I can't necessarily go on that 10-mile hike, but I can do this one, or I can't necessarily go to that restaurant because I can't eat anything there, but I can go to this one. You're constantly advocating for yourself in these ways that people don't really always think about. But yeah, I think there was just a point in my life where I had to say, okay, I'm either going to hold myself back constantly, take myself out of the equation, not let myself have certain experiences and let this like fear and trauma and upset win, which to be honest with you, there were years when I let myself do that. There were years when I said, no, I'm not going to go to that party, or I'm not going to go on that first date, or I'm not going to, tell that guy that I like him, or whatever it might be, because it's so painful and it's so hard. And it feels like really just too much of a hurdle for me. And I didn't have the confidence. but it's been a chipping away, and so I really do like to stress that, because I don't want anyone to, hear me talking now and think that I've got it all figured out. Like, no, it's a day-to-day process. But I think for me, it's kind of come to the place where I've been like, I'm not going to be the reason why I'm not going to have an opportunity. And that's really like, at the end of the day, if I know that I did everything I can't help it if I go to that friend and tell them what I need, or I go on that date and show them who I am, and they don't want to show up for me. Like, that I can't control. But I can help if I'm going to show up.
Yeah.
And so that's kind of been my motto, and the thing that I've sort of had to persevere through and push through over the years.
I love that. And so much of what you're talking about is vulnerability, right? And being vulnerable in front of others, even when they're loved ones, is the hardest thing in the world. And that's a process to find your voice and ultimately find confidence. It takes practice with these examples, finding the words to use and what feels right to you, and ultimately deciding, this is who I want to be. This is how I want to show up to the world. Right.
Yeah, I love that you brought vulnerability in there, because I think people sometimes forget, like, yes, like, be vulnerable, but then you also need to set yourself up for success for the vulnerability hangover that sometimes, a lot of times, most of the time, happens afterwards, right? So take that step. A lot of times people will take that vulnerability step, which is really amazing that you can get yourself there. But I think a huge part of my practice has been supporting myself in the vulnerability hangover that happens after I make the phone call or after I advocate. Like, sometimes after a big thing, I know that I'm going to have no meetings afterwards, or I'm going to have to like have a gluten-free cookie that I love, or, go on a walk or whatever it is, because I need that sort of love and compassion and protection for myself, that I just did this thing that's really hard. And so it's not just about taking that step. It's about having that full cycle of support for yourself, for sure.
Oh, that's so powerful. I've never heard that term, vulnerability hangover.
Oh, I think Brene Brown made it up. I did not make it up. I'm pretty sure I got it from Brene.
Yeah, of course. Okay. Well, of course, she's the first one I thought of. But taking care of yourself, right? Doing this big, scary thing, and then taking care of yourself afterwards, no matter how it turns out, right? Even when it's met with a positive reaction. That was a big, scary thing. There's a lot of stress hormones that just rushed into the system, right?
Yeah, for
taking care of
sure.
yourself and what you need, and being in touch with yourself to know what are the resources and strategies that you guys recommend when trying to find balance in terms of the mental and physical health. We're talking about it right now, right? The mental, emotional load that can come with the daily challenges, the ups and downs, the uncertainty. Nitika, you jump right in, because we're already here talking about it, right? Well, how do you take care of yourself?
Yeah, I think for me, the biggest thing, I'm such a people person. And so even though like so much of what I do is virtual now, I think having that connection with others has just always been a huge part of my journey. And it does like break that cycle of isolation, right? So there's this cycle that happens when you feel separated and othered because of your condition or your health or what's going on with your body. And so constantly trying to break that for myself is a huge part of my healing journey, I guess you could call it. So honestly, like, I created the thing that I needed the most, which is my company Chronicon. And it is just heart-centered, warm, cozy, amazing, vibrant place with people from all over the world that are connecting. And we have resources and events every week, and we have content every day, and we have a live event and all these wonderful things. But it's really about the energy and like the vibrancy that we can bring to life in every moment, even when we're going through some of the darkest moments of our lives. And so resources, I saw someone in the comments earlier put something about like memoirs and, loving to like read memoirs. And then people were talking about walking and all those things. I think all that stuff is a part of it. It doesn't have to be, rocket science for you to have resources that are going to support you. I think the biggest thing, and I'm always coming back to this, is knowing yourself and knowing what your needs are specifically, taking that time to say, like, what are the 5 things that I feel so much better when I engage with these 5 things, whether it's a group of people, whether it's like a certain dessert. Clearly I'm like having a sweet tooth today. I don't know. It's like not
right
even
there with you
yet, but I'm like already thinking about cake. I don't know what's going on, but so whether it's that, for me, community is such a huge part of it and feeling seen, feeling like we have fun, all of that kind of stuff. So having that list of 5 things so that when you are going through that harder time and you don't have like the confidence just waiting for you, and you feel like it's a bit harder to find, you can go to that note in your phone or, in your journal and say, okay, whenever I listen to an audiobook, I always feel better. So I'm going to go do that, give myself a break and like come back to this later or whatever it might be. So I think those kinds of lifestyle resources are really great. And a lot of times they're honestly also really affordable, which is something that I think is super important too. You don't have to break the bank into like a cryofacial for you to like have an experience, you can just pick up a memoir at the library and like be transformed.
Right.
So
Step outside. Right.
Yeah, exactly.
All my patients I work with will say, I'm a broker record. What are the tools in your toolbox? And different tools are going to work for different challenges and at different times, and reach for those, but know they're there. Have your list of 5 things that are there. Going back to the community though, because it's so important and so powerful, but it can be scary to show up, especially that first time. And sometimes, multiple times until you make connections or you get a sense of it, you get a lay of the land. What would you tell people that haven't shown up yet, but are thinking about it, but are hesitating? What would you say?
First of all, I have so much compassion for people because I created the community. So like, I'm happy to show up, but I haven't shown up in other communities as much because of the same reason. So I just want people to know I really get it. The thing with the Chronicon community specifically is that we have created an environment that is so kind, so nurturing, so supportive. You go in there and you just know like everyone is on the same page and coming from a really heart-centered place. I would say for any community, but for sure for Chronicon too, it works if you work it. So it's like, how much do you really want it? Like if you keep saying to yourself, I'm frustrated that I don't have people who get it, or I'm frustrated that I feel alone, whatever those things might be, just starting to evaluate, like, am I showing up? Am I pushing past that, discomfort enough to be able to actually say, I really tried this and then it didn't work? And if the answer is no, like keep going back to it and keep trying. And sometimes, we have a thing with our community, like, you can come to an event and you don't have to have your camera on. You don't have to speak. You just come and sit and be in the energy, warm yourself up to it. Even people here who are, participating today, it's like getting that great information, feeling supported, feeling like they're in a community in this event in and of itself, because there's great conversations going on in the chat, So how much are you willing to show up? Because these communities exist and they're being built to support you and to love you and to, take care of you in all of these ways. But then the next step is like, you have to kind of say, okay, I'm ready. I'm done feeling alone and I'm going to show up for this as much as you can, little by little.
Yeah. Well, I love that. Okay. So basically saying this is going to be a vulnerable thing that I do. Can I be brave for this next half an hour and show up and take care of myself after, plan that cookie or plan that walk afterwards. I'll take care of myself. Can I just be brave for this? And if it still feels too scary, taking those, are there baby steps? Can I just show up without my camera and not talk? Are there baby steps I can take? I love that. Okay. Molly, do you have anything?
No, I think it's fair. A lot of what Nitika had mentioned is resonating. And I think really that sense of community, that peer support, whether that's finding a group or a friend or a mental health provider, that is certainly something I think that just rises to the top on how to help manage and bring about mental balance in an individual. And there's certainly it might look a little bit different for everybody, but we certainly hear from our patient community that is really, really important. And I think that probably resonated in some of the earlier comments that that I made. We also provide forums for webinars and for folks to gather and to build that sense of community. So we are later this month, we're hosting it's called our Autoimmune Community Summit, and it brings together autoimmune patients of all kinds. They're caregivers, providers, researchers, and we're really talking about a lot of the issues that we touched on today. And it's getting at achieving well-being and balance. So there's sessions on mental health and autoimmunity, obviously relationships, managing care, health equity, navigating a career in autoimmune disease, all of those things. We'll have discussion boards that allow patients to participate, engage in the conversation, and build that community. But that, it's a free event. It's open to everybody. So Nitika kind of talking about new communities to hop into. Certainly I can do more of that. We would welcome anybody who's listening to participate as well. Because I just think like as you gather and you connect with others in your situation, you can derive a lot of strength for that. The other thing that I wanted to mention in terms of a resource around mental health is that I'm really excited that the Autoimmune Association recently partnered with the National Alliance on Mental Illness, NAMI, which you may have heard it referred to, on what's called the Reimagine Crisis campaign. And so this initiative brings together a diverse group of leading organizations to reimagine our national response to people who are experiencing a mental health crisis. So one of the key things that we're doing is we're working together to bring attention to the implementation of 988, which is the new 3-digit number to contact the Suicide and Crisis Lifeline. So I encourage you to write it down, to share it, certainly as you see fit. And then we're also advocating with these groups to push leaders at the national, state, and local levels to take really bold actions and policies to provide funding and programming to build a robust crisis response system in the U.S. So, and then finally, I'll say kind of coming out of all of these conversations that we've had in these roundtable discussions that we're engaging in, we're looking at how we can build in, to our organization a more permanent patient discussions, pilot support groups. We're going to pilot patient support groups, see how that works, explore how it could be structured. So more to come on that front. But we're excited about all of these different things.
So you mentioned, that's exciting. Thank you for that important information, and particularly suicide hotline and having that information, getting that information more out there. And then, so I'm just thinking back when you mentioned you guys are really making an effort to do town halls and to learn from the experiences of minoritized groups, whether that's racial, ethnic subgroups or sexual gender minorities. Do you have any suggestions for, when we talk about vulnerability and showing up, there's an added layer there if you're feeling like a marginalized part of the even patient community, right? Are those being built in with the other efforts you're doing in terms of patient support groups, or what would you suggest there, and what have you learned?
Yeah, I think that when you're talking about these communities, it's a part of what we've learned is creating safe spaces for those communities to connect with each other. I think to Nitika's point, like it can be scary to engage. You may not be ready to do it right away, but I think when we're having these conversations, they're led by representatives of the community. The participants are representative of the community. And so I think that we've seen, it was interesting in some of them too, because Nitika's right, like it can take a while to come out of your shell, but in the course of the conversations, most of them are about an hour and a half, you could see some of the participants who weren't talking use their voice and speak up. And what they had to say was fantastic and phenomenal. So I think it's creating those spaces that are designed specifically for the community that you're talking to is really critical.
Yeah, I love that, protected and safe. And then that can be a really empowering experience for the person who's participating. Last but certainly not least, maybe most importantly, how do we advocate for people living with chronic illnesses? How do we advocate for loved ones? I mean, we can build in self-advocacy here too. What are the most important things to be thinking about? Molly, continue on.
Yeah, and I think, so as an advocacy organization, we break this down in maybe a few different ways. And advocacy can look different, but based upon who you're talking to, right? So as an organization, we look at policies in the regulatory and legislative realm, like how do we break those down? And certainly individuals who have a loved one who's facing this can participate in advocacy organizations with patient groups like ours and others to really elevate their voice in these environments, to knock down barriers that we know exist, for patients being able to get the prescriptions that their doctors prescribe. And so I think that's really one realm where you can collectively join the community and elevate the full community voice that has impacts in every single patient. I think too, we as an advocacy organization, we think of environments like research settings and clinical trials. And what I mean by that is we can bring the voice of the patient directly to the manufacturers who are developing the therapies for our patient community. So we can help bridge that gap between the patient and the science. And I'm sure, as everyone's fully aware, there can often be a lot of hesitancy around participating, in a clinical trial. And so I think as an advocacy organization, we can really serve as a trusted resource with patients about these hesitancies, just discuss how they can safely consider participating. And in a sense, I really see that as a very powerful way we as patient advocacy organizations and the patients themselves can join and partner on advocacy, because the more individuals participate, the more the research is strengthened, and then the next generations of therapies are realized, and that can positively benefit everybody. So, but and also on an individual level, Dr. Benedict, we work to be a resource and a partner that empowers patients to be their own best self-advocate, and I think that Nitika did a fantastic job of describing that and what it meant to her. Certainly in clinical settings, and we work with patients to get best practices that we can share with the patient community that they've found has worked well. So for patients and for caregivers, when they go into a meeting, they've kept a calendar that tracks the symptoms that maybe they're experiencing, when their last flare was, coming prepared to the doctor's appointment with key questions and goals that they want to get out of the visit, when they may have a limited amount of time. So at the end of the day, these are all different ways to approach advocacy. But at the end, it puts the patient squarely in the middle, and it's their well-being that's in mind.
Yeah, you bring up an important point, or you bring up lots of important points. One that comes to mind in terms of thinking about research, there's very real and significant reasons why people have that hesitation to join clinical trials, again, particularly among minoritized groups, right? I think equally as important that sometimes gets missed is the responsibility of researchers themselves to communicate back with the patient community, have that, in many ways, equal relationship where I respect you enough that I'm not just quote unquote, having you participate, taking your data, and then I'm not communicating back. And so there needs to be an evolution here of the culture around that, where researchers are more involved, right? And not just sort of in an ivory tower, but circling back. And I think there's probably some collaboration that can happen with the advocacy groups such as yourself, and being the conduit where some of that communication can happen.
Yeah, that's exactly right. And that does happen. I think that's, the exciting thing about it is, the science is great, but there can be a well-informed scientist who understands the patient may approach their work a little bit differently. They may not, the things that they're prioritizing that's important for a patient may not actually be what the patient feels is a priority in their own life in terms of what they want from their treatment. So I think when we can transfer that patient voice and vice versa, it's a level of comfort, it's a level of understanding that we're able to, kind of serve as the conduit between those two worlds.
Yeah, it's so important. I mean, obviously the patient experience and the patient priorities, communicating that, and then hearing what happened with the clinical trial that I participated in. Where is this research going? Make it easier to figure this out for, there's so much that the patient is in charge of, so much on their shoulders. Make it easier, help us out. Okay, thank you. Nitika, what do you think about advocacy, supporting loved ones that are coping with chronic illness, and then self-advocacy?
There's so much I could say about advocacy, and I know, Molly touched on so many important points. I definitely want to focus mostly on self-advocacy because it's, I think, what I know the most about.
Yeah.
For me, I think, Molly did mention some great points about that as well. But one of the things I'm always going to go back to doing a bit of that inner work for you in terms of getting your own understanding of where you're coming from, what needs aren't being met, and what are the things that are really feeling like you're not being heard around, and doing that work and sort of sitting down with that before you go into an important appointment, I think is incredibly, incredibly important. Because a lot of times what happens is we bring all of these feelings and all of this upset and all of this frustration to those appointments where we're like, okay, we're going to get these results, or we're going to finally see this doctor we've been waiting to see for months. And we're just not really preparing ourselves in the ways that we really could be so that we can get the most out of that time, which is often a very short amount of time that we have with this person. So I think understanding where you're coming from, sitting down with someone that you trust, I think has been really valuable. I think we can feel like we're taking all of this on by ourselves, and it is our body, it is our health. So we of course need to have that responsibility, but I think we sometimes isolate in those ways too and feel like, oh, how can we really burden someone, or how can we really bring this to someone? But oftentimes we have maybe even just one person who would really like to be a part of our journey. And if we, again, be a little bit vulnerable and saying, I'm having a hard time. Can you talk this through with me? Can you talk this out with me before I go to my appointment? It's honestly like night and day how much more you're able to show up to an appointment like that and really get the support that you need. I've also done things where when I'm in a flare or I'm having a harder time with my health and I'm going to some of those more intense appointments where I've brought someone with me, and I think that really helps. And even like I've even recorded my appointments before, which people might think is strange, but like when I'm going through new things, I literally will say to my doctor, like, can I do a voice recorder of this? And I even see this comment, like sometimes people, find that their friends and family have a hard time really understanding the impact of their chronic illness. Do they have any tips for helping them understand? Yeah, and stop rolling their eyes. Oh my gosh, we hear this all the time in the community, and that's why we have the Chronicon community, because sometimes to get the people in our lives to understand it, it is a bit of a stretch. So I think I know it can be hard, but maybe we're looking to people that we want to be the ones that can support us, but there are people who are adjacent. Maybe it's a friend that was just an acquaintance and not as close as your best friend, but that particular person actually has much more knowledge or empathy. So sometimes we have to do a little bit more of that digging, which again, I hate that we put the labor back on the patient, but if we do a little bit of that work in the beginning, it can be really helpful. And then, I think Molly mentioned like writing down the questions beforehand is really, really important and just helps so much. So constantly going back to what are your needs, knowing your own needs, and then being able to support yourself in a full kind of circular way and like a foundational way that's not just in one point of the conversation, but the entire journey of what you're going through.
You make a great point. I work with patients sometimes where I'll have them literally write down the people in their lives with an arrow and say, what kind of support are they good? We all have that friend that's good for going out and having a good time and distracting from my problems and just, forgetting it all. And then there's a different friend that's good for crying on their shoulder, right?
Yeah. And a lot of times, I've been going through this so much too, like even with the pandemic, I feel like it's been a great clarifier, and I think illness can be a great clarifier. And sometimes that's not always easy, and that doesn't mean that it's bad. It's just not necessarily what I had hoped or what I had thought that was going to happen. So giving yourself the grace that like there might be some grieving as a part of this process. There might be some disappointment or sadness, but that doesn't always mean that it's bad. That sometimes can just mean you're getting closer to a truth, to understanding what's real in your life, And I see people, mentioning like even just getting through feeling tired. Someone was mentioning something about how do you keep motivation on the days that you're tired. I think it all goes back to a lot of this, like having that community around you. And honestly, sometimes a community can be 2 people. It doesn't mean that you have 50 people. Sometimes it's like that one person, that one friend, or, that organization or that group. But we have to do the work in order to set ourselves up for that. And it's not always easy and it's not always fair. Honestly, like it feels so much more fair if I could just wake up and say, hey guys, I have this diagnosis. Don't you just want to like show up for me and like take me, make sure that I feel comfortable and like make sure that I feel supported and seen and all of these things. But truthfully, most people aren't taught how to support other people in times of crisis. Most people aren't taught how to have empathy until they're maybe put into a situation where they have to truly learn empathy. So for us to understand that, not try to control or force it or try to have it be different, but then do the work to say, okay, I'm going to go find it. If it's the last thing I do, I'm going to find one person who gets what I'm going through today. And like, that's the job that I have in front of me.
Yeah, I love that. And, I think you're probably right too. It does, the onus is on you to sort of find the community and join it. For the family member, the best friend that's out there listening, who wants to be there, who wants to show up, but doesn't have the words. Do you have any advice for them for check-ins? What are the words, just checking in on you. I love you.
Yeah, such a
What
great
can I
question.
do? What are the words that someone should use?
Honestly, you should ask the person what they need. And I think that is, when we feel helpless, a lot of times when we want to show up for someone, we sometimes give unsolicited advice. That's like, we don't usually need that. 9 times out of 10, I've already tried the weird cream that you're going to tell me that I need to try. So like, I don't need you to tell me to like rub turmeric all over myself or like do whatever you're going to tell me to do. 9 times out of 10, I've already tried it. And if it was going to work, it probably would have 30 years ago. So I don't really need that advice. I don't need unsolicited advice. So I think that's the biggest thing. I always find when you're in front of someone who's going through a crisis, ask them what they need. And it literally could just be your friend calls you, she's crying, she's really upset, your sister, your daughter, whatever it might be. And you say, I'm so sorry that you're going through this right now. First of all, acknowledging them is huge. Most of the time people just want to feel seen. So I'm so sorry you're going through this right now. This sounds so hard. Oh my God, what a relief to just hear that from someone, right? And just be seen. That in and of itself, I find is like 50% of it. Okay.
Yeah.
And then from there, say, what would be helpful right now? Like, do you want a distraction? Do you want me to send you like cute puppy videos, which honestly really help me sometimes? Do you want me to come over? Do you want me to check in with you later? Did you just need to vent? What do you actually need? And to be honest, people rarely ask that question, that when someone does, it's like the clouds have parted and like, it's just like such a relief to have someone even just acknowledge you, but then also ask you what you actually need. And sometimes the person might be like, honestly, I don't know. Can you check in with me later? I'm really having a hard time. I'm not sure. But I think if you can stick with acknowledging the person, not offering unsolicited advice and asking them what they actually need, you'll be in great shape and you'll be doing a lot better than most people do when they try to support someone.
I love that. Showing up, just showing up. I'm here for you. I'm here for you.
Yeah.
Okay. I love that. That's so important to hear.
Oh, do I need a deep breath? But yes, it is, because the 3 of you are something else. And thank you for sharing so much that so many of us absolutely needed to hear and spend some time with today. I will also point out, knowing that today served many of us a similar conversation in some ways that included one of today's attendees, Melody Narain Blackwell, the wonderfully dynamic founder of Color of Crohn's, happened about a year ago, and a link is in the chat if you'd like to hear her input and experience on similar issues of well-being and thriving, because she's such a leader in the space, and we're grateful to be able to spend time with her. Similarly, thank you to our panelists today for leading us on this conversation. We are incredibly grateful and look forward to sharing the link with all of you soon. Thank you for being here. Additionally, just a quick reminder, you each are invited to GVCC, so please do sign up, even if your goal is to see the videos afterward, and we will share those with you. So thank you all as I try to catch my emotional self so I can put sentences together after all of these important resources, which we will also make sure are available on the Advocacy Exchange website. So thank you, Catherine, Nitika, Molly, for being with us today. Thank all of you for attending and sharing in the chat and the resources and this wonderful dialogue. Your advocacy makes the world a better place, and we're happy to be here with each and every one of you today.